Assalamu alaikum. Let's start our today's session. We have patient named Mr. John. He is 35 years, came with complaint of weakness. Let's start after the time starts. I will show the timer. So, Dr. Rasha, are you ready?
Yes.
Okay, here you are.
Okay. Hello. Good evening. My name is Dr.
Hey.
Al-Mahdi. I am Dr. in class here today. Can I confirm I am talking to the Mr. John?
Yeah, I am.
Are you 35 years old?
Yeah, doctor. I am.
Okay. Mr. John, we are here to discuss about your health status, and after that, and examine you and address your concern. That's okay with you?
Sure.
Okay. I received a letter from your GP states me that you have weakness. Can you tell me since how long you suffer from this weakness?
Doctor, it's being with me for a long time, maybe months now. I have
Long
this
time.
problem.
Once it starts,
Yeah.
Yes, once the start, it was sudden or gradually?
No, gradually.
Is it increase or decrease or the same?
Increasing day after day.
Okay, where's the site of the weakness?
It's in my shoulder, doctor. And I cannot comb my hair. It's so difficult for me to comb my hair. And
Yes.
sometimes while climbing the stairs, it's like that, doctor.
Yes. In the both sides and your shoulder, you mean left and right shoulder?
Yeah, doctor. Same. Both sides, yes, doctor.
Okay. You are telling me you suffer from the difficult to the combing the hair or sitting up from the chair, yes?
Yeah.
Yes. This the weakness is you think is the weakness is the more difficult to the combing the hair is difficult weakness more than the picking up the object, yes? As understand
Yes,
you
doctor.
correctly.
Yes. Yeah. I can take the things, okay, but even the brush, I can hold it well. But when I comb my hair with this brush, I
Okay.
feel difficult
Do you
to
know
do.
do you noted any pain in your shoulder or in
No,
in your
doctor.
thigh?
No pain at all, doctor.
No pain. Okay. Do you noted any problem in the sensation? Any pains
No,
and the
doctor.
sensation?
No, it's okay with me.
Okay. Do you noted any headache?
No, doctor.
Any blurred vision?
No, doctor.
Any dropping to the eyelid?
Yes, doctor. I noticed that some change of my facial appearance. It's not always the same. Some change, doctor. I feel it's asymmetrical, not as the usual person.
Okay. Since how long?
The same, doctor. It's being worse now, but it was started at the same time.
Okay. In both your eye?
Yes, both eyelids, sometimes dropping, but it's not equal. Some time also I feel my mouth like dropping. It's like that, doctor. Yes.
Okay. Do you notice any double vision?
No. In only the eyelid dropping, but the vision is okay, doctor.
Any drooling of the saliva?
No, doctor.
Any deviation to your mouth?
Yeah, I feel like my mouth angle like down little bit from that other side, and sometimes the other side being like the same. So it's yeah, both sides affected, but it's not together.
Okay. Do you notice any abnormal fat?
Fat? What you mean, doctor?
Fat.
You mean
Abnormal movement?
no fat, doctor.
There's no any benzonated sensation.
No,
Any lost the awareness?
no, doctor.
Okay, and is the control to the back passage or waterwork?
No.
Okay, any problem in the swallowing?
No, doctor.
Any problem in the speech?
No.
Okay. Any history of high body temperature?
No.
What about your weight?
The same.
What about your appetite?
It's good.
Okay, any history of tiredness?
No, doctor.
Any history of neck swelling?
No.
Any history of shaking of your hand?
No.
Any history of pallor?
No.
Any history of tummy pain?
No.
Tummy distension?
No.
Any problem into any change into the bowel habit?
No.
Any joint pain?
No.
Any skin rash?
No.
Any skin rash into the sun exposed area?
No.
Any problem to the waterwork?
No.
Any frothy urine?
No.
Any medical history I should aware of?
No, doctor. I am fit and fine apart from this weakness, doctor.
Okay. Show me the medication list.
I don't take any medication, doctor. I took some medicine for vitamins. My friend told me it might help, but I feel no effect, doctor.
Okay. Which name?
Uh, three vitamin. It's called like this, combined of some vitamins.
Any history of high blood pressure or high blood sugar or
No,
high
doctor.
lipid?
No.
Okay. Any family history of the same illness?
I'm adopted, doctor.
Are you brief surgery?
No.
Any brief admission to the hospital?
No.
What are you do for living?
I'm a cleaner, doctor.
How much the symptom affected to the job and daily activity?
So much, doctor. It's depending on my muscle build, and you see, I'm not that much strong, man.
I am sorry for that. I will refer to the occupational health worker and social worker to help you regarding this the issue. Do you smoke?
Thank you. No, doctor.
Do you drink alcohol?
Yeah, socially.
دول الناس اللي قتلوهم في الشارع قالوا شارع الدب كعب قتلوا الناس كلهم.
Okay. Can I examine you?
Yes, sure, doctor.
I want to examine the general look into the patient and general surrounding.
Yeah, by the look, you will see. I will share his picture and his picture. Okay, but he's fine. The look is normal average. This is the picture you can see in the screen.
Okay.
Yeah, this is the patient in front of you. What you want to examine else?
I want to examine the hand if there's any joint pain, any skin tiredness,
No joint pain,
tightness
no
of the
skin,
skin.
no tightness of the skin, no rash, no joint issue.
I want to check the vital sign.
Yeah, blood pressure is 120/80. Pulse is 65 regular.
I want to, yes.
No change of the character. Yes.
I want to examine the proximal myopathy.
Yes. You feel weakness against resistance while he's doing abduction. He cannot do strong abduction.
You feel
and you notice and you notice the deltoid muscle is little weak and it's not well performed.
Okay, I want to do CNS examination by adduction and abduction.
Okay, CNS, you mean
Uh-huh.
tone power?
Yes, tone power reflex.
Tone and power reflex distally are okay. Proximally at the deltoid muscle, I told you the bulk of deltoid is weak or no bulk of the deltoid, and weakness in the abduction and abduction. All the movement in around the shoulder weak.
Yes, I want to check the scapula if there any wing of scapula.
How to do that?
By ask the patient to push the wall.
Excellent. Yes, he pushed the wall, and you saw the scapula more winging up. No winging, more winging up. Yes.
I want to see if there's any deltoid wasting.
Yeah, well, there is wasting of the deltoid. I told you. What else you want to examine?
I want to examine the eye for pallor and jaundice, and also I want to
Nothing.
check the ptosis and eye
No,
movement.
everything is okay. His movement, all eye movement are okay, normal.
I want to check the muscle of mastification.
Little, how you want to examine? By asking what to do.
Yes, ask the patient to clench his teeth and
Yeah.
palpate the masseter muscle.
Excellent. Yes, there is some weakness, and when you ask him to whistle, there is inability to whistle. He can't whistle.
Okay. I want to examine the neck for any thyroid enlargement.
No.
Okay. I want to examine auscultate the heart for S1 and S2.
Normal, S1, S2, no added sound, no murmur.
Okay, I want to examine the lower limb, the proximal muscle weakness.
Yeah, you ask him to sit, to stand from sitting without support, but yeah, he cannot do it. He's not able to do.
Yes, I want to check if there's any weakness in the thigh muscle, and also if there's any cuff muscle enlargement.
Yes, there is some compensation in the cuff, and the thigh are weak and wasted. Yes, you're right.
I want to check if there's any auscultation in the chest.
Nothing in the auscultation.
I want to examine the abdomen if there's any organomegaly.
No organomegaly.
I want to examine the back if there's any kyphosis.
No deformity. Excellent. No deformity in the back.
Okay, and I want to ask the patient to check the gait.
Excellent. On time. Okay. He's trying to walk, but you see his waddling gait. His pelvic are moving in the waddling method. Yes.
Okay. What's your concern?
Doctor, what I have, and I have another concern, doctor. Will my kids have this disease?
Well, regarding your symptom, and after I examine you, I believe you have a condition is the called facioscapular myopathy. This the disease runs in your family, leading to the symptom that you have. I think that your children higher chance to get the disease more than general population because the disease runs in your family.
What do you mean by high chance? How much, doctor, percentage?
You mean 50% your children may get the disease.
Doctor, will you do something for me to treat me?
Yes, I will refer you to the group specialist, include the joint doctor and specialized nurse to provide to the proper management plan. And also I want to do run some blood tests and imaging to confirm our diagnosis and exclude the other causes.
Okay. Any cure for my disease, doctor?
Your worry is understandable, but yes, disease may be due to the abnormality on the gene. There is not curable, but we can help you by it's not a curable disease.
Excellent.
But I
Okay,
think
time is up.
we'll follow
Time
up.
is up. Time is
Okay.
up, yes. I just added some concerns because you have some time and you did all concerns and the case perfect. I can give you full mark in this case for Russia. Thank you. Okay, let's start the examiner time.
Welcome. Mhm.
Okay. What's your case?
Facioscapular dystrophy.
Excellent.
Proximal
Okay,
proximal myopathy.
excellent. What the differential for this case?
The differential may be Baker disease. Mhm. But
It's
I
called?
think, but against there's no affected the scapula and there's no affected the face.
What is the
And
disease
there's, I
called? Sorry?
think,
The disease?
Baker disease.
Baker. Okay. Okay, what else?
Yes, but there's no affected in the face and there's no not caused the wing scapula, and I think is asymmetrical, not bilateral.
Okay, yes. Okay.
And the
What
second
else? Give me
differential,
two more. Yes.
yes, the second differential diagnosis may be related to the dermatomyositis and polymyositis, but there's no pain and there's no other feature. The
And
third
no
differential
rash.
diagnosis may be the third differential diagnosis may be related to the endocrine disorder like hypothyroidism or Cushing or acromegaly, but there's no any feature of this.
Excellent. Okay, give me another genetic disease which can be differential in this case. Familial condition.
Genetic disease.
Okay.
I think
Hold
في disease is called limb-girdle مش عارف.
Excellent. Limb girdle. Yeah, this is the one I want. Limb girdle muscular dystrophy. This is
Yes.
the most related or the most close relation with the facioscapulohumeral dystrophy or fish disease, FSHD. Okay. What's the mode of inheritance of this disease?
Autosomal dominant.
Excellent. And how you do with this patient? How you investigate and manage him?
Apart from the basic investigation, CBC, LFT, inflammatory marker, I want to do the CK and the EMG and
Excellent.
also muscle
What
biopsy.
you expect the CK?
I think increase or normal. I'm not sure.
Yes, yeah, high, because any muscle disease, it will be high. Okay. And apart from basic investigation, you will do everything, CBC, right? And you should also roll out autoimmune antibodies, thyroid. So just mention these things before mentioning the specific investigation, okay? What else? The muscle biopsy, you said? Okay, what else?
Yes, muscle biopsy.
Okay, what else?
And also I want to do other investigation to exclude the complication. I think one of the complication affected the heart and cardiomyopathy, ECG and echo.
No heart affection in this disease, actually. So it's okay. Skip it. Okay, what else for the disease? Other neurophysiological study you want to do?
For the disease?
Other neurophysiological study. Neurophysiological study. EMG you want to do?
Yes, EMG, yes.
Yeah, EMG, okay. And to confirm diagnosis? Specific to confirm?
I think to confirm diagnosis, this is defect in the some protein. is the
So genetic
Comm
test.
dystrophin gene. Yes, genetic test.
Okay, how you manage this patient?
Pharmacological, non-pharmacological, patient education, patient counseling, psychological and social support, and refer to the group specialist, include the genetic doctor and I think there's no any curative specific treatment.
Excellent. Yeah, so just play on the team. I mean, you mentioned a lot of team involvement. You tell me who else you will invite in this patient?
Gland
Physiotherapy?
doctor or yes,
Physiotherapy?
physiotherapist, yes.
Yeah, orthosis, some orthosis for the shoulder. Okay.
Yes.
Yeah, but in general, no specific management, no pharmacological treatment, but there is a medication called albuterol to improve the muscle strength. Okay. So
Yes.
your test is done, Dr. Rasha. Let's set the timer, then have the comments. The comment is perfect, really perfect. It's like full mark. You deserve it. You did the analysis well from the start, onset course duration, and initially you ask good question. Where is exactly the weakness? From this question, you got the case. It was proximal, and I told you it's related also to some facial look change. You did analysis of the CNS, great. You rolled out any CNS affection, pins and needles, headache, swallowing, shaking, fitting, or fits. Then the endocrine, you ask for the neck swelling, GI, tummy pain, distension, habits, bowel habits, genitourinary, any change of the urine, frothy urine. Just the only system you missed, which is short of breath or cough. Skin, you ask for a skin rash, joint pain, and constitutional symptoms. You ask them every single item. You ask temperature, weight, appetite, tiredness, pallor, family history. Adopted means, as you know, adopted in the exam means familial disease. So you did it great. And for the travel, no need. The medical history, you ask for medication. I give you some medication like vitamins. And the last thing is the HIV. You didn't ask about any partner, any good relationship. That's okay. It's not related here. The job, you ask me and you refer me to the occupational, the smoking, the alcohol, but the driving, it's little important here. You didn't ask. At least you asked me if it's affecting my driving, if I'm driving. Then the examination was targeted, hands and the vitals you did. For the shoulder movement up and down and all movement around the shoulder, you ask, and the wasting of the muscle. The facial, yes, you ask for the facial appearance and look, any deformity. The skin, you ask for any rash, the muscle, and the standing from sitting. Then heart examination, just to have a look for the association or complication. Really, I don't have a lot of comments, but you did the case perfect way. Yeah, thank you, Dr. Rasha. If we have any comments, yeah.
Thank you, Dr. Bess, for your comment.
Thanks a lot. Okay, let's read the comments. If anyone has comments, he can say or we can read it. Okay, all are happy for your performance, Dr. Rasha. What is the case? Okay, the weakness. Really excellent by Dr. Roda. Yes, mashallah. Too much confident, Dr. Rasha. Even you didn't reach the diagnosis area, but when you asked me for the scapula, winging of the scapula, how to do it, it was great to tell me just push the wall. Yeah, Dr. Fatma wrote myotonia dystrophica. Yes, can be Duchenne by Dr. Ihda. But Dosh and Dr. Ihda not living long. The Baker are the one. Genetic testing for formation, yes. Yeah, Dr. Fatma, clap for you. Dr. Ihda, mashallah, Dr. Roda. Main difference. So yeah, our differential in this patient, limb girdle the first because genetic, and the same picture. The limb girdle all are proximal myopathy, proximal weakness, I mean. And genetic testing is the differentiating tool in this patient, as well as some of hypothyroidism, endocrinology, I mean, and some of autoimmune can be also one of the differential, like dermatomyositis and polymyositis, but against that will be the rash and other autoimmune association. But limb girdle is the one should be mentioned in this case. The gate, yes, I made the gate. When you asked me for the gate, it was also a great question, and you did it at the end because if the patient is weak to move, like Parkinson, he will take time, but you did it at the end. It was great timing for the test. Yeah, I think no comment for your performance, Dr. Asha. Drug-induced myopathy, sure, Dr. Drug-induced myopathy, steroid and statin, yes, of course. Thanks a lot. So if any comment or any question? Okay, if no comment, no question, we can move to the second scenario because the time already late.
Mhm.
Rasha, can you write the scenario, please?
Okay. Okay.
Dr. Rasha, yes. Mr. Ahmed,
Yes.
present
Mhm.
with, yeah, I found it. Present with
Uncontrolled.
uncontrolled blood
Okay.
pressure 170 over 100. Okay, 2 minutes, then we'll start. The age, please, Dr. Rasha, the age. Okay, let's start. Dr. Rasha, ready?
Okay.
Okay, we'll start the timer. Hello there. This is Dr. Mukhtar, the doctor in
Hello?
the clinic
Mhm.
today. You must be Mr. Ahmed. You are 40 years old.
Yes, I am.
Okay, we are here to discuss about your health issue. Is that okay for you?
Yes.
Can you tell me more about your blood pressure? I hear that your blood pressure is difficult to
Yes.
control.
Mhm. Yes, doctor. Recently, I suffer from high blood pressure, reach into the high reading since in the last 2 months. The doctor tried to give me some medication, but doctor, they failed to control it.
So sorry to hear that, Mr. Ahmed. And it was started
Mhm.
when this blood pressure, high blood pressure, since when it started?
Start since 1 month back.
Okay, and before that you were okay, no high blood pressure at all, or it was high but difficult to control?
Yes, it was high, but difficult to control.
Okay, and what medication you started on?
Start some medication is the called amlodipine, and also start in the medication is the mm, thiazide, but still not controlled.
Are you compliant to this medication?
Yes, doctor.
Did you take another medication or added another medication?
No, doctor.
Okay, and apart from these drugs, did you take any medication for any other long-standing disease?
No, doctor.
Are you known to be having high blood sugar as well?
No.
Okay, any other medical condition I should be aware of?
Yes, doctor. I have condition um, uh, like the same my father, but the doctor said to me this the disease is runs in family.
May I
But
know
there's
this?
no any curative treatment for it.
Do you know
I
the
think
name?
neurofibromatosis. Yes,
Okay.
neurofibromatosis.
Okay, I am so sorry to hear that. What about your father? How is your father?
Yes, my father is okay.
Okay, sorry again to hear about that, Mr. Ahmed. And let me ask you some further question. Is that okay?
Yes, doctor, please.
Yeah. Apart from this medication, are you taking any over-counter medication?
No,
Sorry for this question. Do you or did you ever take recreational drugs?
no,
Any diet change recently?
no.
Are you taking balanced diet?
Yes, doctor.
Okay. Any herbal remedies are you taking recently?
No.
Okay. You have any headache, Mr. Ahmed?
Yes, doctor, sometime when I was high blood pressure.
And this headache comes in attacks. Do you notice that?
Yes, doctor.
Okay. Along with this headache,
Yes,
you
doctor.
feel,
When I go to the hospital, mm,
yeah. Yeah, continue, please,
mm,
Mr. Ahmed.
you feel
Yes.
what? Uh, when I feel headache, doctor, go to the hospital, and when I check the blood pressure, it was high.
Okay. Okay. Along with this headaches, do you feel like your hand shaking
Yes, doctor.
and any sweating over your body?
No.
Okay. This headache nature, is it like dull aching or an uncertain area or all over your head?
Um, like dull aching.
Okay, and the scale of this headache from 0 is no pain and 10 is the maximum. How much you can scale this headache?
Between 6 and 7.
You have any headache right now? You want some painkiller?
No, doctor, no.
Okay. This headache, when it comes, do you feel like it's worse when you sneeze or you lean forward or you cough?
No, doctor.
Any vision affection?
Sometimes I feel blurred vision.
Is it in the daytime or nighttime?
There's no any special time.
Okay. Any balance change? Any affection of your balance? You feel unsteady?
No.
Okay. Any hearing affection, Mr. Ahmed?
Yes, doctor, sometimes I feel my hearing is not good.
Okay. If both ears?
Yes, doctor.
Okay, sorry for that. Do you notice your face being changed in the shape, asymmetric?
No.
Any affection of your cough or swallowing? Sorry. Do you have any difficult swallowing?
No.
Any lumps or bumps in front of your neck?
No.
Any weather preferences?
No.
Any pins and needles?
No.
Okay. Any cough or short of breath?
Yes, doctor, I have cough.
Can I know more about this cough? When it was started?
Yes, doctor, it was a dry cough since 3 months.
Any blood coming with this?
No.
Any phlegm?
No.
Okay. Any short of breath along with this cough?
Yes, doctor.
And it was while sitting or standing or walking?
No, doctor, is not related to the sitting or standing or walking.
Okay. And you notice this cough or waking you from sleep?
No.
Any acid taste in your mouth?
No.
How many pillows you are using, Mr. Ahmed?
Recently I used it too.
And before it was less?
Yes.
And any noisy breathing you feel or you hear?
No.
Okay. Any chest pain?
Or what?
Any
No.
chest pain? Any
No.
awareness of your heartbeat?
No.
Any change of your bowel habit
No.
in the form of loose motion or hard stool?
No.
Any mood change recently, Mr. Ahmed?
No.
Okay. Any change of any tummy pain at all?
No, doctor.
Any change of your water work?
Yes,
Any,
doctor. Recently, I think
yeah.
decrease the amount of the water work.
Any flank pain or pain in your side of the tummy?
No.
How the water work amount decrease along with this? Any change of the color?
Yes, yes, doctor. I think there's become more darkness in color.
Okay. Any passing gravels or stones?
No. No.
Any blood coming with it?
No.
Okay. And any pain while passing this water work? Any pain?
No, no, not pain.
Okay. You feel any thirsty?
No.
Okay. Any decrease of your appetite or weight?
No.
Any lumps or bumps in your body?
No.
Any rising temperature or night sweat?
No.
Apart from these things, you told me your father had the same problem, right?
Mm-hmm.
Your father had a kidney problem?
No, doctor.
Did he have a transplant?
No,
Any history of cancer in your family?
no,
Any travel recently?
no.
Any skin rash or joint pain? Or any skin rash? Sorry.
Yes, doctor, I have some skin rash, but doctor said to me this related the disease.
Okay. And any joint pain?
No,
Okay. And you have any casual relationships? Sorry for this question.
no, doctor.
You have partner?
No, doctor.
Okay. What's your job, Mr. Ahmed?
Doctor, I job I'm not getting the job, doctor, because
Okay.
my problem I can't get any job.
I'm so sorry for that. We can arrange with our social to support you in this regard. Is that okay for you? Do you smoke?
Yes, doctor, thank you.
Do you
No,
smoke? Do you drink alcohol?
no,
Did you drive or do you
no,
drive?
no,
Okay. Let's
doctor.
examine you, Mr. Ahmed. I will start by general look. How is the weight? He's underweight or an average weight?
The weight is okay.
Okay. Vitals in both arms, right and left.
Vital, the blood pressure 170 over 100.
In the
The
right.
picture in a group.
Okay. In the right. In the left, how much?
In the right, this
How much? Hello, Dr. Rasha?
yes. Okay.
Yeah.
Both are
Okay.
raised.
Okay, both are raised. Okay, any I will examine the facial now. Any deformity in the face? There is, yeah, there is skin lesions. Okay. Any lesion in the freckling in the axilla? Any freckling in the axilla?
Yes, there's some darkness. Yes, yes, yes.
Coffee ole lesion? Coffee ole?
Yes, there's coffee ole. There are other picture. Yes,
Okay.
there's coffee ole in the back.
The hearing, I will examine the hearing. Any affection of the hearing?
How can test affection of the
By
hearing?
yeah, by sound moving my finger around or near to the ears.
No, no.
Okay, any vision affection, I will offer fundoscopy or a slit lamp for any
Yes,
flesh nodule.
yes, fundoscopy. There is nodule.
Okay, now I will examine
And
for
there's
the.
hypertension, retinopathy.
Okay, now I will go to the heart examination. Any valve lesion, aortic stenosis, any murmur?
There's no, but there's murmur.
There is murmur, functioning murmur.
Yes.
Okay, functional murmur. Okay, and now I will examine the abdomen. Any polycystic, any palatable kidneys, roll out polycystic, I mean.
No, there's no any palatable kidneys.
Any flank pain?
No.
Any bone deformity in the legs?
Yes, there's deformity in the back. Kyphosis in the back.
Kyphosis in the back. Okay. And the leg, any leg swelling?
In the leg, there's no deformity.
Any leg swelling?
There's no leg swelling.
Okay, may I know your concern,
No
Mr.
leg swelling.
Ahmed? Okay, the concern, please.
Doctor, I want to know what I have. Why blood pressure is still high?
Yeah, Mr. Ahmed, I'm afraid to say that you have the same condition as your father, and there is some association of another disease called pheochromocytoma. It's sometimes associated with the original disease, the familial one you took from your father. So to confirm the diagnosis, we have to do run some investigation and some image to confirm our diagnosis. Is that okay for you?
Yes, doctor. You mean this related to the underlying condition?
Yes, association of your familial condition.
Mm-hmm.
You have any other concern?
Mm-hmm. Is it curable, doctor?
I'm afraid to say no cure from disease, but don't worry, we will try our best to control your blood pressure and to make these symptoms
Mm-hmm.
less. Okay, time is up.
Mm-hmm. But doctor, mm-hmm. Mm-hmm. Okay.
Okay, you can tell me the last concern. Just try to answer it. What is the concern?
Okay, but doctor, why, yes, but doctor, why the water work is decreased?
Yes, I am afraid to say maybe there is kidney affection in your disease and your condition. For that, I could do some image and scan to your kidney to reach to the bottom of this problem. That's okay for you?
Yes, doctor.
Okay, let's go to the examiner time. Okay,
Mm-hmm.
so Mr. Ahmed,
What's your
yeah,
case?
yeah, Mr. Ahmed, 40 years, came with a complaint of high blood pressure, although he's taking the medication on thiazide and amlodipine, but
Mm-hmm.
still his blood pressure uncontrolled. He has headache, comes in attacks, along with the shaking of the hands and sweating. There is some vision affection and hearing as well. Decreased urine recently. Apart from this, by examination, he has features of neurofibromatosis, and it was positive family history from his father. He has the neurofibromas in the face and the lesion nodules and the retinopathy in the eye and axillary freckling, cafe au lait lesions, and kyphosis.
Mm-hmm.
No palatable kidneys appreciated. Functional murmur I heard over the heart. So my differential, top of my differential
Okay. What's
neurofibromatosis,
uh-huh.
yeah, associated with pheochromocytoma and might be
Uh-huh.
complicated with renal cell cancer or polycystic kidney. And to confirm that, we should do further investigation. So another differential in this patient, I could think about renal artery stenosis, and I could
Mm-hmm.
think about, yeah, in young age, I could think about coarctation of aorta, but against that, the blood pressure equal in both arms, and essential tremors, essential hypertension if no reason for his blood pressure, but uh, actually he's having features of pheochromocytoma.
Based on what pheochromocytoma? Did you check any renal bruit?
No, I didn't hear the suspected abdomen. However, he has
Mm-hmm.
episodes of headache and shaking of the hands and sweating. It might be
But the patient
pheochromocytoma sign.
not episode of the headache. Patient high blood pressure since 1 month.
Okay.
Mm-hmm.
So maybe
Okay. What the cause of
renal artery
high blood
stenosis.
pressure in? Yes, renal artery stenosis. What the cause of high blood pressure in neurofibromatosis?
Yeah, it could be association with pheochromocytoma. Could be renal artery stenosis.
Mm-hmm.
Could be
Mm-hmm.
polycystic kidney disease.
Mm-hmm.
And could be renal cell carcinoma.
Mm-hmm.
And maybe cardiac association,
Mm-hmm.
like aortic stenosis or
Okay.
coarctation of aorta.
Uh-huh. Okay. What the criteria of neurofibromatosis?
Yeah, the criteria axillary prickling, leash nodule in the eyes, and neurofibromatosis in the skin, more than 6 and more than 15 millimeter in size,
Mhm.
and cafe au lait lesion in the back or in the chest, axillary and inguinal dimension, axillary and inguinal prickling, and osteoma or deformity in the bone. Yeah, this is
Mhm.
so 4 out of 7, it's and family history as well. 4 out of 7 of this criteria, it's diagnostic for neurofibromatosis type 1. As long as this patient has no
Okay.
affection of the brain stem, so I can consider type 1.
Mhm. What the criteria of the neurofibromatosis type 2?
Yeah, brain stem tumor, like schwannoma or any affection of cranial nerves might be there, as well as the cerebellum.
Mhm. Okay. If this the case is diagnosis renal artery stenosis, how can investigate?
Yeah, I will start by the baseline investigation, complete blood count, and the kidney function, electrolyte, urea and creatinine, full electrolyte. I will do all parathyroid hormone and magnesium, phosphorus, potassium, and calcium. And I will do inflammatory markers, CRP, ASR, coagulation profile, liver function test. Specific test for this patient, I will do renal angiotensin ratio. It will be
Mhm.
high in this patient. And urine analysis dipstick for proteinuria or other complication like hematuria.
Specific
Apart
test for
from
renal
this,
artery stenosis.
specific, yeah, CT angio of the renal vessels. CT angio. I can do
Mhm.
also
How can treat?
ultrasound Doppler. Yeah, treatment.
How can treat?
Multidisciplinary team approach, including the nephrologist, genetic genetic specialist, and neurologist, ophthalmologist, and hematologist. I might need also cardiologist for high blood pressure resistant, and a nephrologist, as I mentioned, social worker, GP, and specialized nurse. Non-pharmacological education, counseling about disease and complication and association, and genetic testing and counseling for the family and his siblings. The pharmacological treatment, I might need to start some antihypertensive specific for renal artery stenosis after including the nephrologist. So he
Okay.
might
Why does
start,
patient have cough and shortness of breath?
yeah, as a complication of renal artery stenosis, patient might have pulmonary edema due to severe stenosis of the renal artery. It might happen in attacks, and it might presented with the symptoms, flash pulmonary edema, I mean, and he might need immediate intubation and emergency management.
But the
Especially
patient,
if the
if
high,
auscultated the chest, but the patient there's no any
no,
pulmonary edema.
yeah, but it might come in attack, and in between
No
attack, he
pulmonary
might
edema.
be, yeah, in between attack, he might be clear or free of some symptoms and signs.
Time up ولا still?
Yeah, 8 minutes. Okay, tell me now. 8 minutes, Dr. Rashid. But I guess there is lagging in the answer and the question. some lag in the
Yes.
time. Yeah. Okay. So give me start the comment, and we'll
Okay.
have the comment from other. Yes, please.
Yes. Overall كويس. بس في عندي كومنت. البيشنت يعني الباك جراوند تاعها فيه كروموسيتوما، قصدي نيوروفايبروماتوسس. وبيشنت جايب uncontrolled blood pressure وبيشنت receive treatment but the patient is still uncontrolled. Once in the patient uncontrolled blood pressure, most likely plus in a renal symptom, most likely in a renal artery stenosis, the first, the second في chromocytoma. A patient have history of handshaking, but there's no any history of sweat. Ask me about sweat, but answer you, no, there's no any sweat.
Okay. Okay.
Yeah. The second patient background neurofibromatosis, the third differential diagnosis, patient meningioma may be related into the high intracranial blood pressure.
Okay.
Okay. Okay. The second is important as auscultation renal bruit is important.
Yes. Yes. I missed this.
The other important the blood pressure with end organ damage or not, patient if there's any weakness or not. الموست common في الاكزامينيشن البرونيتر درافت، لان patient جايب high blood
Yes.
pressure وفي chromocytomal background most likely انها تكون intracranial blood pressure CNS tumor، فالبرونيتر درافت is important. الcause of dry cough و shortness of breath, one of the complication of neurofibromatosis lung fibrosis.
Okay.
الامبورتنت في الاكزامينيشن الهيرنج تيست الويبر والرنن
Yes.
عشان to exclude
Sensorineural or collection.
second type of neurofibromatosis. Yes
Yeah.
فimportant كان الويبر والرنن تيست كان important. Yes, الفندوسكوبي كان important والبرونيتر درافت كانت برضو important, but overall كويس يعني excellent.
Thank you, Dr. Rasha. Thanks a lot of this case. It's nice association between renal artery stenosis and neurofibromatosis. However, I mentioned number 2 in the differential, but let me say that when I ask you about the sweating, I hear like maybe due to the lagging, maybe I heard
you
wrong.
asked me about handshaking. You said yes. Ask me about handshaking. I told you yes, but sweat no.
Maybe due to the lagging and the sound, maybe I heard something else. It's okay.
Yes.
But we are learning from the mistakes. Thank you for this case. It's a nice one. And the association of lung fibrosis, first time to hear about. But pulmonary edema, I guess
association
also
with the lung fibrosis.
Yeah.
Yes, pulmonary edema can happen with the renal artery stenosis.
Yeah.
But pulmonary edema not a dry cough.
Yeah, sure. But this is the only explanation I can put in this patient. That's why I mention it. It's okay. So
yes, okay.
Our case
yes
is clear now.
But I want to add something because the patient yes neurofibromatosis you've seen into the other patient maybe cardiomyopathy with the neurofibromatosis, lung fibrosis with the neurofibromatosis, high intracranial blood pressure with the neurofibromatosis, back pain, kyphosis, eye symptom, والhearing والويبر والرنن is important.
Yeah, agree. Yes. Yes. Okay.
Yes.
Thanks. Thank you, Dr. Rasha. Any other comments or any question?
Welcome.
Thank you so much. Okay, let's read the comments. Kindly the case here. Yes. Okay. What the cause of shorter break? Yes, we answered this question, Dr. Roda. Well done. Thank you, Dr. Roda. Dr. Hunaida also. Well done, both of you. Thank you. Thanks all. If no question regarding this patient and differential and examination, so let's go to the communication. Dr. Rasha, we need to roll out min to be. Yeah, you mean cytoma and parathyroid. But I asked, that's why I asked for the amount, it was less. And the mode, I asked for the mode to roll out hyperparathyroidism and hypercalcemia as well. It was negative. Better to ask about the thirsty and yeah, if I feel thirsty most of the time to roll out hypercalcemia. Other question of renal system, I asked for the renal stone, renal gravels, hematuria. It will be also with hypercalcemia and hypercalciuria. So yes, you can put fucromcytoma, but I guess the unlucky patient will have two gene or genetic disease, LIN2B and neurofibromatosis. Why? He will be the book of medicine, two cases together. Okay, but it's okay. We can ask for the hyperparathyroidism. Yes. Examination of thyroid or offer as medullary association. I guess this patient will not have both the condition together. So I didn't even put it in the differential. Yeah, so two genetic to be in one patient. I don't think so. Dr. Rabia, can you repeat? What are causes of high blood pressure in neurofibromatosis? Yes. Okay. So starting by association of pheochromocytoma, one of the reasons. Renal artery stenosis, one of the other uh, association. And the third association, polycystic kidney disease and renal cell carcinoma. Any kidney affection might be there in neurofibromatosis. As well as, yes,
And
coarctation of
meningioma.
aorta
Mhm.
and meningioma, yes.
And meningioma.
Okay.
Although
Yes.
meningioma cannot cause high blood pressure. How will cause high blood pressure?
Yeah, Dr. Rasha, the question. Von Hippel-Lindau, yes, we can ask for von Hippel-Lindau if association of hamartomas, but it's not there. We can add it still. We can add it, but it will
Hello?
not be presented. Yes, Dr. Rasha. Yeah, someone mentioned von Hippel-Lindau disease, but I'm explaining with the von Hippel-Lindau, the association will not be hypertension. Von Hippel-Lindau will be like hamartomas in the eye, cerebellum, lesion, unsteadiness. That's why we asked earlier for the unsteadiness and the balance. And other association of von Hippel-Lindau, some hamartomas all over the body. So it will be discovered in the CT. Yeah, well, of course, the association with pheochromocytoma, but it's how meningioma cause hypertension. Dr. Rasha, this question, why meningioma cause high blood pressure? Maybe she mean intracranial intracranial pressure, but systemic blood pressure, Dr. Rasha? Yeah, idiopathic hypertension, intracranial hypertension. I guess so, not systemic hypertension. Okay. Okay, any question else associated? How meningioma? Okay, we mentioned it. Okay, any other question? Let's move to the communication. Dr. Abdul Malik and Dr. I forget again, sorry. Who else? Dr. Abdul Malik and sorry, Dr. Abdul Malik and Dr. Taysir.
أيوة السلام عليكم.
عليكم السلام ورحمة الله وبركاته. Dr. Taysir present, but Dr. Abdul Malik, I guess he's not here. Okay. If Dr. Abdul Malik not there, we
I
can.
will send my case.
No, wait. We should find the other candidate first. No candidate yet. Okay, who's the volunteer? Dr. Roda or Dr. Rimaz? They sent me. They want to practice.
If Dr. Rima is not available, I will take.
Uh, okay, Dr. Rimaz, I guess her exam is soon, right?
I think so. But I think if she doesn't want, I may take.
Yeah, she sent me as well. You sent me and she sent me. So we can give her the priority for the exam. Then if
Yeah.
not, you will do it, okay?
Okay.
Hello.
Yeah, you're there, Dr. Imaz. Good.
Yes.
Just sent you the message. Okay. Sorry. One candidate is absent, and for your sake of the exam, we will give you the priority with Dr. Taisir. Sorry, Dr. Roda. We can give you tomorrow communication, I promise. But today we give Dr. Rimaz because her exam is soon. When is your exam, Dr. Rimaz? After
No,
how many days? Sorry?
The 9th of June.
9th? It's
Okay.
how many
4
days?
days.
Maybe. Oh my God. Good luck. Best of luck, Dr. Rimaz. You can do it. Inshallah, you will do it.
Inshallah.
Okay. Don't be stressed. You are excellent. Okay, the patient scenario is in chat box. You can read it loudly to start after 2 minutes. Please read it. You can
Okay.
read? You can see? Yeah.
Yeah. So it says Mr. John, 60 years old, complaining of no KC
non
of
case.
rheumatoid, known
Non
case of
case.
rheumatoid arthritis on methotrexate. 3 days ago, he developed UTI. They gave him Cotrimoxazole. Then he developed bleeding per gum. CBC shows pancytopenia. Please sit with Mr. Edward, his son, explain to him the situation of his father and address his concerns. You are assigned to our medical department.
Okay. I'll give you 2 minutes. Then we'll start. 12:30.
Okay, we can start.
Okay, just I will share the timer, then you can start.
Okay.
Here you are.
Okay, hello?
Yes,
Hello?
hello. Yes, yeah, hello.
Hi, good evening.
Good evening, doctor.
Hi, am I speaking to Mr. Edward?
Yes,
And you're Mr. John's son?
yes, doctor.
Hi, my name is Dr. Turkawi, and I'm one of the doctors in the medical department today. Um, I understand that we're here to talk about your father's health.
Yes, doctor.
Okay, so do you mind telling me what's your idea of what's going on?
I have no idea, doctor. Actually, I know that my father he has complicated with this rheumatoid arthritis for a long time, doctor, and he's doing well regarding that. 3 days back, he developed a bug infection in his water work in in his urine, and then the doctor said to me he will admit him. But doctor, today he developed this bleeding per gum, doctor, and he's feeling tired. I don't know what's going on. That is why I came for you here to discuss with me what's going on, doctor.
Okay. So yeah, I'm sorry for what your father's been going through. He struggled with his rheumatoid arthritis, but it was controlled with the methotrexate. That's what I understand. Um, and what do you expect today, Mr. Edward?
Yes, to tell me what is going on, doctor. I don't know. He's even they do for him some blood test, doctor. I want to see what is going on.
Okay, all right. So yes, you are right. Your father, obviously, I took your father's permission to talk to you about his health. So your father's known to have rheumatoid arthritis, and he's been taking methotrexate for a while now, and it has been working for him, hasn't it?
Yeah.
Okay, and he received some antibiotic, a medication, to help him with the waterwork infection that he had 3 days ago. However, the antibiotics have some interaction with the methotrexate. Are you following me?
Yes, I'm following you. What do you mean by that, doctor?
What I mean is that there is an interaction between the antibiotic, the medication that he received, and the methotrexate that he's on. And this interaction actually make methotrexate more available in the blood, so the Mr. John suffered from the side effects even more and more.
Wait, doctor. You mean that what happened for my father because this is a mistake? Stupid doctor gives him this antibiotic. You mean that?
Well, Mr. Edward, I understand, and I'm really sorry that things had to come this way, and I'm here to apologize to you about the this fault. We will need to look further into this. We will need to look further into this. However, I want you to accept my sincere apologies for this.
What apologies, doctor? This I don't know. From you are playing with the people. From which university they graduated to give us problems? He come by simple bug infection. Now he present with bleeding per gum, doctor. No. This is not acceptable at all, doctor. How this is this hospital? There is negligence here.
I agree with you that this is not how things usually happen. It's Mr. John is known to have the rheumatoid arthritis, and it's in his record that he takes methotrexate. Cotrimoxazole is one of the medications that we usually use to treat the waterwork infection. However, as I said, when someone is on methotrexate, we try to avoid giving him medications like cotrimoxazole. I understand. I can see that you are frustrated, Mr. Edward, and we will report and advise Mr. John about what happened, and we will offer him a sincere apology. As I said, I'm apologizing on behalf of the team, but because this is not how we usually do things here, we will we will put an incident report in place. making sure that this doesn't happen again. Is that okay? Are you following me, Mr. John? Mr. Edward, sorry.
Yes, I'm following you, doctor. Doctor, actually, I want to complain, doctor, about this doctor. This doctor give my father this bug infection, bug medicine.
Okay. Yeah, well, Mr. Edward, I believe you and Mr. John have the right to complain, but what we would do is we try I can arrange you a meeting with the nurse in charge and with the ward manager and also with the consultant on of the who's responsible of Mr. John. We will highlight this in the morning meeting. And we will make sure that this is an incident report that needs to be investigated to find out what happened and why and how. And as I said, Mr. John, and you and us, we will try to make sure that this doesn't happen in the future to anyone else, and not just to Mr. John. How does that sound?
So you're not let me to complain, doctor.
No, definitely you have all the right to complain. You can always complain. There is a totally separate independent entity called the PALS, which is Patients Advisory and Liaison Services. They're completely independent entity who investigate and try to understand what happened, and they can take the complaint very seriously. And I want you to be rest assured, Mr. Edward, that Mr. John's care will not be affected by the complaint.
Okay, doctor. I need the name of the doctor who prescribed this medicine for my father.
Okay, it will be very difficult now to give you any further details, Mr. Edward. As I said, we need to investigate this further to find out what happened, and I understand that this is really frustrating for you and for Mr. John, and I can see that you are both unhappy with what happened, which is completely okay, and it's worth it. But it would be I can't give you the doctor's name. However, as I said, we will investigate this and we will involve you in this investigation.
Okay, doctor.
Okay. And did you have any further concerns, Mr. Edward?
Is my father will be okay, doctor?
Okay. I just want to ask you, how does he feel now?
Yeah, he's feeling tired and he's developed this blood from his nose and from gum, doctor. What you
Yeah.
will do about that? This bug infection will be killed. You will stop this medicine. What we will do? How you will going to treat my father?
Okay, this is a very good question. What we will start doing is that as you said, the first step was doing the blood test. We did the blood test and it showed that he had low counts in all the 3 counts of the blood. That's why his bleeding has been happening, because the clotting factors will be not working effectively. His defense system will be a little bit weakened, and his blood count, he might have some anemia as well. So what we were going to do is we're going to keep him in the hospital, probably give him some blood if needed, and try to put him in an isolated room to make sure that he doesn't catch any infection. He will be seen by a multidisciplinary team to look after him, but we will have to stop the methotrexate for now.
Okay, doctor.
Okay.
Thank you.
Yeah,
Okay.
so that we can stop any further worsening of his condition. Any other questions, Mr. Edward?
No, doctor.
Okay. I might just need to ask you, do you think is there anything that we can do to help Mr. John at home or in the community?
Thank you. All right. All right. Thank you, doctor.
Okay, he's well supported and he doesn't need any help. What about smoking? Does he smoke?
No.
Okay, good. That's great. So yeah, as I said, Mr. Edward, let me try to summarize the important things that we talked about today. Mr. John had a waterwork infection. He received antibiotics that made the methotrexate some kind of toxicity condition. He had low white cell count, and that's why he had the bleeding. We will have to admit him to the hospital. We will have to stop his medication, and we'll have to get seniors to look after him. You have the right to complain, and we will put an incident report in place.
If the time is up, Dr. Thanks, Dr. Rimaz. Let's hear the comment from Dr. Taisir, then I will comment.
Okay.
Okay, you did well, Dr. Rimaz, mashallah. A few comments from me. Maybe I will give the chance for Dr. Basim to comment. Yes, first of all, you should ask me, I am the next of kin or no for this Mr. Edward, Mr. John. This is the first thing. Second thing, yes, you explained to me what's happening, going on, expectation, everything. Yes, and you tell me there is, you admit there is a mistake. You tell me there is a mistake and there is a medical error. I get angry. Then you start for me this 5A. You should same like you do. You appreciate my feeling. You apologize and admit admit there is a mistake. And even you tell me what's your action you will go on to do, as this is medically and legally. And from the start, before the surrogate asking you, you should tell me that we will going to stop this medicine to involve a group of doctors that contain this to change this antibiotic to another antibiotic suitable with your father, and this will be follow up of his daily blood count. So this because they mentioned they have pancytopenia. After that, I think the summary will not, in communication, we will not make the summary, or even we will not make recap, because you will develop my anger again, and that. And when I ask you, I want to complain, yes, you're right. After I repeat your question for you, then you advise me to pulse. I need pulse from the start. That's all, Dr. Edmas. You did great. Thank you.
Thank you.
Yeah, thanks, Dr. Taisir. Well done, Dr. Rimaz. You're ready for the exam, actually. Just yeah, few comments. Don't feel stressed by the comment. I'm just
I'm not stressed.
repeating.
أنا أصلا يا باسم I'm stressed. يعني حاجة صعبة جدا. يعني
I know,
أنا
I
هسه
know.
نمت. أنا بقيت obsessed بالمذاكرة. أنا نمت وبسمع فيكم. أنت بتقول لي يا دكتور ماس دكتور ماس، حتى أنا صحيت وداخلة
It's
طوالي.
okay. It's okay. Just relax, calm down. You're too much excellent. Don't worry, you can do it, and you will do it. Just feel relaxed the coming days, and don't be more stressed. And the day before exam, just sleep early, and everything will be okay. So the comment in this case, just for the perfection, you did great, but in general. So you can pass easily by this performance. You will pass. Just few comments, and the comment to just to learn to all and to you. Okay. The introduction, you did great. The permission, you did it even later, but you did it. You told him you took the permission while talking in between. What he knows about the condition, the expectation, you did all these points so great. Then the explanation, I like when you said there is interaction between the drug, antibiotics, and the medication for rheumatoid arthritis. And the word increase the level of methotrexate, you can say, yeah, it become more in the blood. Yes, you did it. And the medication antibiotic called Cotrimoxazole is the reason behind that. So he kept being angry. Why? It was by mistake. You apologize immediately. This is great. Apologize on behalf of my team. However, this medication, which is Cotrimoxazole, is best interest for any waterwork infection. In your father case, he shouldn't take it. Why? Because he has interaction, or the medication has interaction with his main drug is taking, which is methotrexate. So shouldn't be prescribed. So it's a medical error. Admit from the first sentence. We have you're right, and there is a mistake. There is an error. We immediately the action after you apologize and admit the action immediately. That's why Dr. Taisir corrected you. What you will do now for my father, but it was at the end. Try to do it earlier to just reassure him. Yeah, we stop the antibiotics immediately when we find that he is already on the methotrexate, and we will find an alternative medication for his condition. Don't mention what is it. Don't say we'll give him another antibiotics called. No, this is not your task. Just stop and alternative. Find the alternative. Okay. What the alternative? If he asks you, we will sit with our team, the professional and expert team. They will find the appropriate medication antibiotic for him, which will not interact with the methotrexate. Regarding the methotrexate, we will hold, and our rheumatoid or our joint doctor will sit with us and will decide when to resume the medication. Okay, just hold, not stop, because stop, he might tell you why you will stop. My father was controlled well with this methotrexate. If you're gonna stop it, yeah, he will have flare-up of methotrexate, sorry, of rheumatoid arthritis, and you will be in trouble. So we will just assess him with the joint doctor and the multidisciplinary team approach, and they will decide the best interest for his condition. To resume, to stop, to hold, to give antidote, to give blood component. It's not your task. Just apologize and give the the action in the view of the team. Okay, not by you. Then he asks you, doctor, from where you are graduated. So it seems that he's so angry, and you absorb this anger by saying, I'm sorry again and again and again. Every angry question or angry reaction from the person or the surrogate, try to absorb by sorry and apologize. As long as there is mistake, apologize. But if no mistake, you can just say sorry. But if there is mistake clear, you apologize and feel sorry for him and for his father. Yeah, you did a great when you told him we will arrange a meeting with our consultants to review incident report and so on. Yeah, it's our steps in any mistake. But please don't forget the action. The action is very important. Okay.
Okay.
Investigation. Yeah, investigate. He told you give me the name, and you told him it's difficult because we don't know. It's even if you know the name, you will not give him. Tell him we are a team. We are treating as a team. So it's not related to the name. It's related to a teamwork. And I'm sorry, we can't give a name because this is a teamwork. However, if you want to complain, it's totally your right to go to what's called.
The problem
I will
is,
guide you.
the problem is,
Sorry?
we had some training in the hospital, and they said if you said I can't or I'm not going to give you the name, they might be angry. Just tell them
Yeah.
that nothing is clear at the moment.
Yeah.
And
Okay.
just like, just manipulate himself, drive him
Yeah.
away
Yeah.
from me. Yeah,
Yeah. You are doing a like diplomatic way not to give him a
exactly. Yeah.
name and not to make him angry more. Okay.
Yes,
This is
exactly.
another professional way. Yeah. So it's not clear now. It's even honestly, we don't know who prescribed this. The investigation will be done, and we will update you about the result of this investigation as soon as we can. Then, yeah, then he raised the issue of the action because you didn't mention the action. So Dr. Taisir was helping you to raise the action. What you will do with my father now? You told here low blood count and clotting factor. I guess also clotting factor here is not. You can mention the bleeding factor because clotting factor. I guess it's jargon. Anyway, I'm not sure. So we will keep your father in the hospital. Great. We will not discharge him. But the isolation, I don't know why you will isolate him because of just low count,
He's
low blood count.
pancytopenic, so he's probably
But
neutropenic as well.
yeah, I know, but not every neutropenic patient will admit because he has no signs of neutropenic fever. He just because of some medication. I'm not sure about as a clinical judgment. I'm not sure about isolation of every neutropenic patient. I'm not sure actually, but no need to mention. We will keep him in hospital and we will manage him accordingly by our professional team. That's it. Multidisciplinary team approach. Yeah, then you told him about stop methotrexate. Better to say withhold or we hold the methotrexate until the doctor of joint will join and will decide. The feeling, yeah, who's supporting him? You ask the smoking, the alcohol. Alcohol you didn't mention, but it's okay. Instead of summarizing try to ask further cosmetic question like support at home, dependent on him, smoking, alcohol, you know, who else can support him, any job. You can find another question, but don't repeat or summarize or recap with angry surrogate. You will just create his anger again, and he will be angry at the end, and the examiner will be angry at the end. This is the general advice. Any angry patient or any angry surrogate, don't re-summarize or recap with him.
Okay.
Okay?
Yeah,
So
fair
you
enough.
can remember these points, please, in the exam, because the exam is so near. You can remember all these advices.
Inshallah.
Yes, okay. Don't stress and be confident. You're excellent. See, even Dr. Taisi, excellent. Dr. Imas, good luck in your exam.
Thank
Sorry
you.
for being tough. No, it's okay, Dr.
No,
Taisi, to
no,
be
that's
tough
very good
here, better
actually.
than, yeah,
Yeah,
better
yeah.
than being angry there, or being difficult to control the angry one there. It's here, okay. Okay, usually in patients, yeah, Dr. Ala, usually in patients on methotrexate who are admitted to the hospital, we hold methotrexate. It's not mentioned in scenario. Anything, if he is still on methotrexate still or not, because cotrimoxazole on its own can cause bone marrow suppression. Yes, I wasn't sure if it's a medical error or just a side effect. At the end, better to say, please accept our apology. Yes, Dr. Hunaida. So for the cotrimoxazole, I agree it will do bone marrow suppression. But in this patient, especially those on methotrexate and rheumatoid and well controlled, why the GP or why the infectious disease will give antibiotics cause interaction? This is the mistake. It's a clear mistake by this scenario, by the way. It's clear mistake, medical error. Why? Because he should review his medication. Once he saw the methotrexate, definitely he will not try to Cotrimoxazole. This is for any ABC. It's not GP or not a specialized doctor. ABC for any patient on medication to prescribe, you should ask him if he's on any medication. And even in the computer on the system, when you prescribe medication, the system alarming you there is interaction between this and this. So it's an error, clear, no doubt about this error. It's in the best interest of the antibiotics for UTI. Yes, I agree. But for any patient who's are not on methotrexate. But if the patient on methotrexate, definitely a mistake. Okay. Usually in patient on methotrexate who are admitted to the hospital, we hold, yes, this is we read medical error scenario. Yes, it's medical error scenario, clear. Yeah, that's why Dr. Hunaida said, repeat apology every time. Thank you, Dr. Rimaz, and the comments, and Dr. Tasi. I guess, I hope also your scenario in the exam will be medical error because it's trending now.
I hope so.
So,
I hope they don't
yeah,
bring the new scenario, you know, the new trend is the transsexual, so the transgender. So now I'm gonna give
yeah,
you this case.
yeah. You
Dr.
attend
Idris.
the session we did it?
Was it
Listen,
about transgender?
yeah, you didn't attend. Seems that
No,
because
okay,
we did
okay. I'm gonna give
maybe,
her then a different scenario.
yeah, let's do it. Yeah.
Which session was it?
Sorry.
Which day was the session so that I can go and attend?
I'm not no, 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 no. I guess before the recording. If no, I'm sure it's before the recording, but we did it. It's okay. Let's do it, and I will comment on it because we have,
Okay.
yeah, we have practiced it before, so I know
Okay.
some background about this case. Okay, let's do it, Dr.
Are you ready,
Taysir.
Dr.
Yes,
Taysir?
yes, yes, I'm ready.
Okay, so you have a 35 years old,
Yes.
um, Lisa wants to speak to you
Okay.
about another patient in the Bay.
Okay.
She has been speaking to the nurses all the day about this patient and that the fact that this patient is transgender, so she's not happy to be in the same bay with the patient. She has been asking questions about the patient. So that's why the nurses asked her to speak to you, so they called you. Mrs. Lisa had UTI and received IV antibiotics, and she feels better now. This is an acute medical ward. And you are the SHO, okay?
Okay.
All right. Do you need 2 minutes?
No, to start.
Okay, great. يلا يا دكتور باسم please timer.
I'm typing after you. Just
Oh,
finish the
thank
typing.
you. Thank
So
you so
Mrs.
much.
Lisa, 35, want to speak to you about another patient with her room, sorry, why a transgender patient being with her in the same room and sharing the bathroom. Like this, okay?
Oh, Dr. Rimad, the patient transgender male or what?
The patient, the patient's gender now is a female.
Yes.
So you don't know, Dr. Taysir, the scenario is not saying he is male or female or whatever. He just transgender one. You don't know what his gender and what's his identity. Okay? Usually it comes like that. And they don't want them to express them like this or this, just like this, okay?
Okay, I understand. Okay.
Yeah. So let's start the timer then.
Okay.
You don't want timer, right? Sure. So we'll start immediate. Okay.
Yes, no problem. From where I will get the information about this? Start. Okay.
Okay.
Hello.
It's a new scenario, by the way. Yeah, start.
Yeah.
Hello.
Hello. This is Dr. Saeed. I am senior house officer. I am doctor in the clinic today. May I confirm that I am talking to Mrs. Lisa, 35 years old?
Yes, doctor.
Okay. It came to my knowledge that Mrs. Lisa, that you want to talk to me. Can you tell me what is going on and what you want to talk about?
Well, to be honest, doctor, I have been very unhappy with what's going on now. I understand that this bay is a female bay. Why do we have a male in the bay using the same toilet and just sharing the bay with us? It doesn't feel safe.
Okay, Mrs. Lisa, I understand your concern, Mrs. Lisa. Actually, let me to make the things here clear for you. This patient beside you, he have a complete right now, and he's we can consider him as a female. And this after he making this transgender, he has complete right to deal with him as a female. And about this sharing the toilet, yes, this also for his right. And about there is any security issue, any bad behavior raised from him, at that time we can take any action as you tell me. Did you understand me, Mrs. Lisa?
I do understand you, doctor, but what do you mean? So do you want me to wait for something to happen so that I can report? Why? Why can't we do something about it now?
Because he has complete right, as I told you, Mrs. Lisa, I understand that. He has complete right to his same like female. We cannot the rule now here. We should respect the rule. Says that he has the complete right to deal with him as female, unless there is no any issue rise from his side. We cannot take any action regard that.
What do you mean, doctor? So are we gonna be why is this person sharing the same toilet with us? Did she or he even have did they do the surgery? Are they females now?
Yes, he's considered now as a female when person making any transgender, and now we consider him after the operation. The gender, it will be decided after the operation, and now after he making this surgery, he considered as a female, as I told you, and we will deal with that issue as a female, and his full right to use the same
He
toilet.
had the surgery then. I thought he didn't have the surgery. Thank you for telling me. But anyway, doctor, I don't feel safe being here using the same toilet with him, and I just want to complain, really.
Okay, I'm assure you that you have full right to complain at any time, and if you want to complain, I will guide you to the office called Patient Advice Relation Office. They will help you in this regard, and our management and our care will not be changed regarding you. Regarding this, he is you are telling that we are not sure he is a male or female. No, he is after. We are not going to admit the patient in the same room with the other patient unless he have the same gender, and by the rule he has this right. Did you have concern for me?
I don't know. You keep saying he have the right. He have the right. So if it's a he, then why is he in a female bay if you still call him he?
No, I'm not. I'm not in, calling he, she now she is Mrs. She. After this transgender operation, now she will rise her as she. Is that right, Mrs. Lisa?
No, to be honest, no, it's not all right. And as I said, I want to complain now. And can I speak to the ward manager or the consultant about this? Because this is just nonsense.
Okay, Mrs. Lisa, you arranged meeting with my consultant to discuss you more about that.
I don't want anyone to discuss things with me. I want to talk to them so that this patient can leave the bay.
I'm really sorry, Mrs. Lisa. I appreciate your concern, but the things will not go like that. But we will arrange meeting with our consultant to discuss you with. He will make you convince you more than me.
I don't want to be convinced, doctor. I don't want someone to convince me.
What you want, Mrs. Lisa?
Anyways, what does she even have? She seems to be okay, or he, and she doesn't seem to need to be in the hospital. It doesn't feel safe sleeping in a bay knowing that there is a man sleeping with us. We don't even know who he is, doctor.
I'm really sorry, Mrs. Lisa,
It's a
for
little
that.
bit scary, and I couldn't sleep since my admission. It's not good for my health. I'm deteriorating now.
I appreciate your concern, Mrs. Lisa. Actually, and now you are doing well, and understand that you have a bug infection. We are starting for you anti bug to kill this bug infection. And now you are doing well. And regarding your medical condition, we are follow up. And if you have issue about that, we will see if there is any empty room. We'll discuss this issue with our consultant. So we will shift you there. Is that
What
all
do you
right with
mean
you?
shift me? What did I do? I didn't do anything wrong. You should shift that patient, not me.
What he do wrong, this patient, Mrs. Lisa? Sorry, is anything arise from her? Okay, Mrs.
Hello?
Lisa.
Yeah?
My
Oh,
time
no,
finished, by the way, Dr. Basim. I am 6 minutes
Ah,
only.
okay. Sorry,
Oh,
you're
you're
Irish.
6 minutes. Okay.
Yes.
Okay, that's why you're so confident about the time because it's still
Is your time what exam is yours?
Irish one. Yes,
Irish.
Irish.
I want
Yeah.
to do the Irish, guys.
You
Okay,
will pass.
but
والله,
not
trust me.
not with this scenario because she didn't convince you yet. Okay, let's hear the
Okay.
comment. Yeah, let's
Okay.
hear the comment, then I will
Okay,
comment.
so Dr. Taysir,
I have no any background about this scenario. That is why. Okay, Dr.
yeah,
Riwan.
that's why I'm sharing it here because I didn't see people actually doing it. So let's start with the simple things first. You said I'm one of the doctors in the clinic while I said we are in an acute medical ward. That's the first thing. Um Another thing that you used multiple times the word I understand. It would be very annoying for the patients when you say I understand, because they might say you don't understand because you're not me. So you just always try to say that I appreciate or I can see. You're frustrated or you're sad or you're upset. But avoid the word I understand. Okay.
Okay.
E word. So he asked you or she asked you whether the patient actually did the patient have the surgery or not. And you said yes, the patient had the surgery, and she does have the right to stay in the ward. This is a confidential information about another patient, and this patient should not have it. You should not share other, uh, confidential informations about patients with other patients. So that's a huge. I think that's a huge mistake. You need to, yeah, about the operation and about the fact that this patient is transgender. All this information you should not share them with another person. Other than that, I think you were trying to convince me and you offered the solution, which is giving me a room. You were a little bit loud at the end. هرشتيني يعني. Um, when I said she should go to a ward, you said, what did she do? She didn't do anything. I think maybe you could have said it in a different way. You can just say, please let me know if anything happened, in a way that we can help you. For example, if there is any uh, any abnormal behaviors or any if you felt unsafe, physically unsafe somehow, or threatened by this patient, you can always report this as a safety netting kind of thing, or reassuring me. I might be asked to not be convinced with what you're gonna say until the last minute, so it should be okay. I don't have any more things to say, to be honest, because I don't know what to say. So
Thank
Yeah.
you for the scenario.
other than that, I think for someone who never knew what to do about this scenario, just like me, you did very well. You were understanding, you were not hesitant, and yeah, you did very well.
Thank you, Dr.
Yeah.
Yunus.
Okay. Thanks, Dr. Rimaz, for the scenario. Thanks, Dr. Taisir, for the harsh and very tough performance. You want her to stay first in the room. And okay, let's comment because you didn't practice this case before. But let me say that you should be more calm with her, not confronting her. I guess all the scenario, you're confronting her and giving the right to the other patient more than her. Yes, the other patient had the right, but also she had the right to be satisfied and convinced by a nice and a calm way. Okay, let's start from the beginning. So you introduce yourself and please, for such scenario, you can reassure her this is like confidential meeting between me and you because maybe the other one doesn't know and she's talking about him. So, and she doesn't want the other one to know about this complaint. So it's just assure confidentiality. This meeting will be confidential between me and you. What happened? Can you tell me what's your concern? And what about your condition like that? Then what's the expectation? I expect, doctor, you will transfer him from my room. Then you can stop here and address the first concern. I appreciate your worry. I can see you're frustrating. I can don't say I understand, as Dr. Rima said. I see you are frustrating. I feel like you are worried. Uh, I am afraid to say I can't do that. Why, doctor? He is not eligible to be with me in the same sharing my room, my washroom, my toilet. I'm afraid to say no, it's his right, or sorry, her right, as long as he chose the identity to be managed or dealt as what he decided. What you mean, doctor? He even didn't do the surgery, or he did the surgery? Do you know? I'm sorry, I can't give you further details about that. This is his autonomy and this is his confidentiality. I cannot tell you about that. Anyway, we are here respecting and applying justice for our patient. All patients managed equally. And his identity now decided to be managed by the patient to be managed as what he wished, whatever male or female, as what he wished. We are managing him like that. Okay, so you told her if something happened from him, that time will, yeah, it's good to reassure her that anything happened from him or from that patient. That time, yeah, this is at the end. You can just reassure him, assure her, Mrs. Lisa, I mean. And you kept saying, this is his right. This is his right to stay here. This is his right to. No, it's not the way to do that. Always be calm while convincing an angry patient or surrogate. I'm afraid to say he has the right to be with the same ward as what he chose to be managed as. His identity now to be managed like this. So uh, our right or his or the right for the patient to do that. Okay. Don't shout while saying something against the patient or surrogate wish, because she wants you to say just to convince her in a calm way that he or she should be stay with her. However, if you want, we can have with bid manager meeting or a call just to find another bid if you don't feel comfortable in this room. If you feel that, let me help you in this regard. The surgery issue, I wrote it here. Yes, we already address. Don't mention anything. Did he do or he did or already done or whatever. This is not our talk, not our concern. This is confidentiality totally and never touch it. Please, Dr. Taisir, don't talk about
Yes,
another
yes, yes,
patient data.
yes.
Yes, okay.
Okay.
Then, yeah, yeah, unsafe to share the toilet. You can offer here some choice or another solution. If you are worried, still arranging another room, we can arrange you another toilet to be used by you. But I can't again force that patient to use another toilet. I can't touch that patient privacy, confidentiality, or tools or bed or whatever. Already he admitted to this word, and I can't force him. If I can do something for you, I will try to call the bid manager to find another bid for you to be comfortable in. Okay, I want to complain. Yes, this is your right, Mrs. Lisa. I can guide you to the office responsible for the complaint, which is called Patient Advice Lesson Services. And don't worry, our management will not be affected or harmed by this complaint. Okay, then you repeat again the right, his right, she right. So don't try not to confront. Yeah, this is her right or the patient right. But by calm way, I can convince her. I'm afraid, I'm worried, I'm appreciating, I see you're frustrating. Some sentences to appreciate her worry, then give her the what you want to tell, even against her wish. Okay? The consultant meeting, she said, no, I don't want to meet anyone. I just want to have another bed. Yeah, she had the right. She can request that. And we have not the consultant, the consultant will say the same words. So I will try to find another bed for you. This is the only solution in her condition. Yeah, let him leave the room. No, I can't do that. This is one of the concern, and I can't do that. If she asks you, please let him leave the room. I want to stay here, and he's the one who will leave. I'm sorry. We are, as we have mentioned before, the justice, our role in this hospital. What is the justice is to treat all patients equally and
Regardless.
no, regardless, yes, the gender or the religion or the nationality. So, doctor, what about his problem? It's his right or the patient right to choose the identity, whatever it is. This is not our decision, not our right to talk about. Okay, then shift me. Yes, I can arrange a meeting, or I can arrange with lead manager to find a bit for you. This is the scenario, and there is another scenario, mother, and you will talk with her son about again another transgender patient with her. I mean the mother. This is the two scenarios, either female or the mother, and you will talk with the son. But anyway, both scenarios try to save the confidentiality of the transgender one. Try to convince either the son or the patient herself. Don't uh, don't breach the confidentiality, and don't try to transfer the transgender one. Try to solve the problem from the side of the patient himself. And there is concern also in the patient, the mother of the son you are sitting with him. If he's insisting to shift the mother, you will shift the mother after approval of the mother, because the mother decision is superior to the son choice. This is
معلش
another
يا
tricky
دكتور،
point.
قول تاني الكلام ده لو سمحت يا دكتور باسم لو سمحت.
I what? I repeat?
السيناريو التاني ده أيوه.
Yeah, the other scenario, mother, female patient, old, 50 plus, and admitted with pneumonia. The same like this, but you will talk with the son. You will talk with the son, her son. And the son also angry because he saw this transgender with his mother in the same room and sharing the same toilet. There is concern there to transfer this transgender, again the same concern here. But once you decided to transfer his mother from the room, you should tell the mother and take her permission, because this is the mother decision, not the son decision. Even he's wishing for that, yes, we will transfer her after talking with her and getting her permission. This is the difference between two scenarios, because the mother will have her autonomy to choose to transfer or not. Even that the son is angry and wishing to transfer his mother, but the decision now for the mother. But in this scenario, Lisa will be the one decided, okay, we will transfer you after we have soon bed available or vacant, we can shift you there. Clear, Dr. Remaz? Okay, Dr.
أيوه
Taysir?
yes yeah ما شاء الله yes.
Yes,
Thank
yes,
you.
yes. If there is any literature, I mean, any books, anything to study this transgender
It
from it?
wasn't, it
Rider,
wasn't,
OC, where?
no, it's
Okay,
new scenario. No
that's the
scenario,
problem.
new, yeah. But I guess there is some guidelines or some paper I will find and I will share to the group about the
It's about
transgender.
reading
Thank
the
you.
NHS policy because
Yeah,
even in the
policy, yes.
hospital we've never been faced with such thing, so we read
Yeah,
about
because they
the
are new.
NHS policy
Yeah,
and
yeah, I will
how
share.
they are inclusive and a lot of like all these things.
Don't worry,
And
I
this
will share
scenario
it to
is
the
appear
group.
in Arab country or
Yeah,
appear
Dubai. It was in
center?
Dubai.
Which center? Dubai.
Dubai.
Mm.
Yeah,
Mm.
anyway. Okay,
Okay.
and it might be like spreading to all overseas or even in UK.
Mm. Okay.
I think it's a
After
Yeah,
trend
that,
it's
in UK now.
trending. Yes, it's trending one. So be ready, because this is the new style scenario, because other scenarios are mostly repeated. Dubai, I guess Dr. Shema, Dubai, yes. I guess Dubai or UAE by which I think Dubai, yes. It was in UAE, but which city? But I think Dubai. The last or the first died in 24, yes. Or sorry, in Egypt. Dubai, then Egypt. Appear in Egypt as well. Dubai, then Egypt. Two cities or two centers. Okay, anyway, I will share the guidelines in the WhatsApp group just to be more aware about the policy and the guidelines. Okay, any comment, any question? No question, I guess. Any unclear in any inquiry? So let's end the recording for tomorrow nomination.
thank you,
If no
Dr.
question,
Rajapasim. Thank you so much,
thank you.
Dr.
Thanks,
Rimas.
Dr. Tassi. Yeah, thank you all. We'll stop recording, then I will do the nomination. Thank
Thank
you
you,
all
Dr.
for a nice session. Thank you all. Thank you.